We have been having public participation with the people of Kisumu County, and as a representative of the people under the legislative arm of the government, I want to say that such kind of partnerships are highly welcome in this county, and we want to urge the partners to work together closely with the government so that we make sure that our people are taken care of. And most of my concern touches on the women and the children, and I'm glad it is a concern for everybody. It also came out from the people that maternal and child mortality rates of this county is alarming, and we want to develop all sorts of mechanisms so that we ensure, if not eradicating, those levels have to go down.
Opportunity to use resources which are already available and combine them with technologies, medical and telecommunication technologies, so that some of the ignored communities, some of the neglected communities can get some basic services like the Madam Minister mentioned in her speech. It's criminal that this day and age that there are some of these very primary, very basic services that are not reaching the communities. And she mentioned maternal health, for instance. In order to prevent those deaths which are happening, which are so completely preventable, what is needed is at times a simple blood pressure check, just to make sure that a woman who probably shows certain signs and symptoms can be isolated and be readied for high-level care when the time comes. Just the preparation itself will save a lot of lives there. And there are hundreds of such possibilities, and we are so excited, and it's also so encouraging for us to receive this level of support. And we are also lucky to find a partner such as KMET, which with their experience on the ground for over I think almost two decades now, will be able to bring our experiences and some of the technologies that have already worked and have been demonstrated to be effective in the poorest states of India. They will now be available in Kenya.
We are so excited about this partnership because with the health indicators in this region, we can't continue to do business as usual. We have to be innovative. It has been documented that women and children are actually dying out there. So we need to take services to the needy, to the underserved communities. So one thing that we have realized is important is being innovative. And I think what happened, the best thing that happened in this country is having a devolved government, because within the counties we are now even closer, and it's easier for us as partners to come together, journey together with the public sector and address some of the challenges in health sector that we are facing. When I talk about maternal mortality, because there is no county that can develop without reducing the unnecessary deaths of women in pregnancy, there are 4 major delays that contribute to the high maternal mortality. The first delay is at the household level, and this is the delay in making the decision and the delay in identifying danger signs. With this technology, we'll be able to identify danger signs, and those making decision will be faster. The second delay is the delay in making a decision. And most of the times, this really contributes to the high number of women that come to us late. The third delay is the delay in reaching the health facility. If you are in Mageta Island today and you have to go to the nearest health facility in Bondo, you might not go after 11 because of the rough waves in the lake. So we want tech services in the hard-to-reach area. The last delay is the delay number 4, which is like the delay that fixes the nail on the coffin of most of the women that we bury in this country. And that is the delay in receiving quality health services. So for us at KMET, we are using technology. We are improving the quality of health services, and we want tech services to the community.
What we want to do is we will now maybe put out an announcement so that we can actually create a forum where they can come. And there are many of them in the 6 sub-counties in this county who are still very active and are still very interested in providing their long experience, their expertise to help us continue transform the health systems in this county. So we will create various forums supported by our partners in which we can engage with them. We will develop projects and programs which we can assign them on maybe on short-term contracts and that sort of thing. But it's an idea that we're just developing right now. And we believe that we can still make use of them because we have a real shortage of qualified healthcare professionals. And if they're still, energetic enough, we think that we can still make use